as you can hear, and we'll be sharing it with you all afterwards and on social media, so feel free to share it with any colleagues who weren't actually able to join the webinar. And today we've got two great presenters who will be speaking about how Parks and Rec systems can be transformed by using an equity lens. And before we get into both of their presentations, just want to give a little bit of background on National Civic League and the All-America City Award in this webinar series. The National Civic League is a 123-year-old nonprofit organization, and we advance civic engagement to create equitable, thriving communities. And one of the ways we do that is through our All-America City Award program, which recognizes 10 communities each year for outstanding civic engagement. And the All-America City Award, we not only want to celebrate the great work that's going on, but we really want to share all the innovative practices that are happening around the country. So we established this monthly webinar series to do just that. We hope that by equipping individuals, institutions, and local governments through this series with different ideas and models that can be adapted into communities, that we can accelerate the pace of change in communities across the country. So for 2017 and 2018, we're really focused on equity, and that's also in our All-America City Award program, which has a theme of promoting equity through inclusive civic engagement. And we would welcome everyone on the line, if you haven't heard of the All-America City Award before, to definitely look into applying. I'll only briefly go over it, but civic engagement is the main criteria, with inclusiveness and equity being right there at the top as well. We also look for collaboration, innovation, impact, and future planning. And as you'll see, there's different parts of the application, but I just wanted to touch on part one, which is how equitable are opportunities in your community. And one of the reasons that we're hosting this webinar today is because we think that Parks and Recreation is a great place where communities can really take a look and do an equity audit of what it looks like in their community for different parts of town, different demographics, is everyone having access to the same kinds of things when it comes to Parks and Rec. And we also have a list of other things that we really want communities to be looking at and doing equity audits in their towns. So that's something you all are interested in. There'll be more information in the follow-up email about the All-America City application. And it's not due until the end of February, so you all have plenty of time if it's not something that you have considered before. Okay, so with that, I will wrap up and get to the meat of our presentation and webinar today. And we're going to start with Jayne Miller, who is the Superintendent of the Minneapolis Parks and Recreation Board. Jayne?
Hi, thank you so much. Before I get started, I want to let everybody know I'm struggling a little bit with laryngitis. So bear with me. I've got a throat lozenge. I may need to take some water, but just wanted people to have a heads up with that. And again, I'm thrilled and honored to lead off this webinar today on equity in Parks and Recreation, what we can be doing to address that issue. And I'm very proud of the work we've done at the Minneapolis Park and Recreation Board. And I'm going to share with everyone 4 very tangible, very on-the-ground specific things that we have done, 2 of which are related to our capital investments, and one is our allocation of resources for recreation centers. And the 4th one is an internal working document that we're doing around the work we do internally in the organization around race and equity. So with that, before I get started, I do want to actually talk a little bit about what's happening in the country and in Minneapolis demographically and trends that are occurring. So if we could advance the slide. So what I want to do is, what's happened in this country has changed dramatically. First of all, the number of people living in urban areas is, compared to 100 years ago, we have completely flipped as a country. We have more than 83% of Americans living in urban areas, the highest in U.S. history, and that's going to continue to climb. Also, the race and ethnicity of this country has changed dramatically since 1950. And in fact, if you look at the statistics here for Minneapolis, we were whiter than the rest of the country in 1950, and we are more diverse than the rest of the country, and will be also by 2020. And I think most people are very surprised to hear that. But those are foundations of information I think you need to know. We can go to the next slide. Also, how our whole households, again, there's a greater percentage of female heads of households who also happen to be predominantly in low-income households as well. And there's a greater percentage of women in the workforce as well across the country than there was in 1950. We can go to the next slide. And in the next 20 years, the changes are going to continue to be very dramatic. The country will become older, particularly as the baby boomers reach age 65, and we will become much more diverse. Hispanics and Asians will continue to increase in this country over the next 20 years. And then also the age of our population. People under the age of 18, that number continues to decline across the United States, and as you can see is even more dramatic in Minneapolis. And yet the senior population in the country is growing, it's doubling in the United States, not growing quite as rapidly in Minneapolis, but again, the senior population is growing. We can go to the next slide. And so what that's telling us is that white non-Hispanic population in this country is older than all other race and ethnic groups in the country. And the median age of white non-Hispanics is rapidly going to continue to rapidly rise over the next 25 years. If you could go back to that slide, sorry. And I think these statistics are really important. Less than 40% of the population that is under the age of 19 are white. 67% of people aged 19 to 54 are white, and 84% of the population of people over 55 is white. Dramatic differences depending on what age you are in this country. And I think, again, as Parks and Recreation professionals, seeing those statistics is really, really important. The youth population is more diverse, and the middle-aged and senior populations are white. So again, very important statistics to understand is service delivery. You can go to the next slide, thank you. White population, median household income, median family, and median per capita income is also much greater than any other race or ethnic group. As I said, our median age in this country is going to increase. Persons of 18 years of age is going to decrease. People over 65 is increased. And that all minority groups are younger than white citizens of this country. And the proportion of youth is not likely to increase. So with that, let me walk you through some really quickly. Again, I think you guys have the documents I sent out. Is that correct? Do people have? All right, so I'll walk you through. So the first thing that we did is we created a criteria-based matrix system for investing in our neighborhood parks and capital and rehabilitation. We have 179 parks in Minneapolis. 160 of them are neighborhood parks. They are the heart and the soul of our system. We also have 16 regional parks, which are larger and draw people from all over the region. In fact, around the country come to our regional parks. And so it's our neighborhood parks have more of the built infrastructure, our recreation centers, our athletic fields, our outdoor basketball courts, tennis courts. Whereas our regional parks are more nature-based, more walking paths, biking paths, those kinds of things. So the issues in those two parks are different. So if you could go to the next slide. So what we have done is we've developed an equity criteria. It's all data-driven and transparent for how we're allocating our resources for our capital needs and our rehabilitation needs in our neighborhood parks. We've divided into two main categories, community characteristics and park characteristics, that then drive the selection of projects. If you go to the next slide. So what we have done is we have built equity into our park investments, that while we have needs all across our system, what we've decided is how we are going to select and prioritize projects over other also important projects. You can go to the next slide. So the way it works is each park is given an objective score for each of the following community and park characteristic criteria. The community characteristic values are at the neighborhood scale, and each neighborhood park that is within a specific neighborhood will receive the same community characteristic scores. The park characteristic values are based on the specific assets within each individual neighborhood park. So for example, we have Willard Park and Farwell Park are both located within the Willard Hay neighborhood, and they will receive the same scores under the community characteristics, but they will receive different scores for park characteristics. You can go to the next slide. So this is our scale. I've provided some handout materials that are not as part of my PowerPoint that literally walk you through in great detail each one of these characteristics and the data source for how we are rating each park based on the community and park characteristics. So the idea is that at the end of this, every park is rated, and I also provided the matrix, the rating sheet, that gives you the raw score for each park, plus the weighted score, and the total score for every park. And the matrix has our parks ordered based on the highest scores to the lowest scores. And the idea is that over a 20-year period of time, we will make capital investments and rehab investments in every single one of our neighborhood parks. But we are prioritizing those that score the highest in these areas. And of our first 6 years, 33 of our 34 parks that we are making our investments in the first 6 years are in racially concentrated areas of poverty. So that demonstrates that the criteria that we've established is actually a representative of making investments based on racial and economic equity. If you could go to the next slide. The other area that we've done, as I mentioned, is we developed the criteria also for our regional parks. And as I mentioned, our regional parks are more nature-based. If you could go to the next slide. And again, we look at community characteristics and park characteristics, that the total score of those will result in a selection project priorities. Next slide. And again, it's about allocating money for rehabilitation and replacement of our amenities and facilities using this criteria-based system. If you go to the next slide. There's a piece of this that is different than in our neighborhood parks. For each of the 19 regional park properties, they are classified as to whether it is an existing part of the regional park and trail system or whether it is an opportunity facility. Opportunity facilities are those regional parks that are not yet substantially connected into the regional park system, either because we have limited land control here at the Park Board or because we don't have complete pedestrian and bicycle connections to and between other regional facilities. So these opportunity facilities are called regional opportunity facilities, and we will make allocations as an organization each year until those regional parks are considered part of the existing system under specific criteria that we've identified for each regional park. The remaining parks, those are which are part of our existing system, are given objective score for each of the community park characteristics. Again, community characteristics for our regional parks are relative to all community areas a park or trail touches. The park characteristics focus on the attributes of the park itself, and the community characteristics have a higher collective point value because investment priority is most critical in those neighborhoods, those parks where overall community need is the greatest. If you go to the next slide. So here are the community and park characteristics for our regional system. And again, I've provided a really detailed handout that walks you through the allocation of resources and the point system for each of these characteristic areas. I've also provided a spreadsheet that shows how each one of our 17 regional parks and our 2 regional opportunity facilities have been allocated their point system, and then how the dollars are being allocated in our system for those parks. If you could go to the next slide. The other thing that we did as part of our 2018 budget process is we looked at how we allocate resources for our recreation centers. We have 49 recreation centers that are across our system in our neighborhood parks. And the biggest resource that we have that makes a difference in our investment is our part-time staffing dollars. And so the more part-time staffing dollars we have, the more programs, services that we can provide. So if you could go to the next slide. What we did is we have 3 tiers of recreation centers in Minneapolis. We have some recreation centers that are open 28 hours a week, some that are open almost 38 hours a week, and another tier that are open 42 hours a week. And what we decided is this is not about prioritizing one rec center over another, but it's about how do we spread all of the resources we have for our rec centers across our system. And we've said every rec center has to have a baseline of funding to meet a minimum of 28 hours a week of service. And so that is in the box on the left, and that money is allocated to every rec center equally. We took the remaining amount, which represents about 53% of the remaining dollars, and split it between community characteristics and site-specific characteristics. If you go to the next slide. So the dark blue is the baseline, which is 43% of the funding. The remaining 57% is split evenly between community and site-specific characteristics. If you go to the next slide. And you'll notice that we have a lot more criteria for our recreation centers, and let me talk a little bit about that. So in the community characteristics, and as we're looking at the characteristics for a rec center, we know the data points that are the average data points across the entire city. So in terms of community characteristics, a rec center within a particular community, if that community with that rec center is more diverse than the city as a whole is, it gets a point. If the health indicators for that neighborhood are worse than the city as a whole, that center gets a point. SNAP participation is our free lunch program. If there's a higher percentage of families in that neighborhood that are part of the SNAP program than the city as a whole, they get a point, and so on. If there are more crimes against people in that community than the city as a whole, they get a point. If the median household income for that community is less than the city average, they get a point. In terms of site-specific characteristics, again, we look at the operating hours of the center. If it's a center that's at Tier 2, it gets 1 point. If it's a center that's at Tier 1, which is the 42 hours, it gets 2 points. We also looked at the number of programs offered at a rec center. So if it's above the average of all the rec centers, it gets a point. We also are looking at the participation per hour of activity, and if it's higher than the average of all of our 49 rec centers, it gets a point. We also have a very extensive teen night owls program that's offered at a number of our rec centers. Some are offered more nights of the week, some offer more comprehensive programming, and so depending on those, it may get up to 1, 2, or 4 additional points. Some of our rec centers have small gyms. They get 2 points. If it has a large gym, it gets 3 points. We also have warming rooms because we have 63 outdoor ice rinks that are attached to our rec centers. So that also adds a point. We also looked at some of our rec centers are housed within parks where there is a lot of activity going on outside of the rec center in the park. Like we have one park that has 7 different athletic fields. We have another park that is rented and used a lot for outdoor events or rentals, activities that are going on that draw hundreds of thousands of people. And so the requirement of the recreation staff then is not only do they have to take care of the center, but they have to spend more time out in the park as well. And so those centers also get a point. And again, I've provided the detailed criteria matrix system that explains each of these measures in detail, what the data source is for calculating these numbers as a handout. And then I've also provided the results of all of the points that our rec centers receive based on community characteristics and site-specific characteristics. And then I also provided a spreadsheet for every rec center showing what their funding was in 2017, what their funding would have been if whether based on the scoring. And you'll notice on that spreadsheet, some of our rec centers were overfunded in 2017 and some were underfunded. And what I made a decision was that we were not going to cut the funding for any rec centers, that even if you were overfunded in 17, you would receive that same amount in 18, but I was able to come up with an additional $233,000 for 18 to allocate to the centers that were underfunded last year, with the idea being that it will probably take us 2 or 3 years to equalize the funding across our recreation centers based on this racial and economic equity criteria. The other thing that I want to point out, in each one of these cases, we have set up a system whereby we will evaluate this criteria for each one of these systems every year to make sure that if there are any unintended consequences, we can look at those and make adjustments. And we expect that over time, by making these equitable investments, that hopefully in 5 or 10 years, some of the demographics of those neighborhoods will change. And as a result, the need or the service level may change across our system because we will have made these investments based on our racial and economic equity criteria. The last piece I want to share with you, if you go to the next slide, is our Racial Equity Action Plan. So as an organization, we've been working on racial equity since about 2011. And we developed a Racial Equity Action Plan in 2016 to reflect what we have heard from community members and groups through our existing relationships and projects, and it also captures any ongoing work that we've done on racial equity over the past years and new initiatives that we believed we needed to do. It establishes very specific timelines, accountability, and performance measures for each action. And again, I've provided hard copies of that for everyone. If you could go to the next slide. And with the Racial Equity Action Plan, it's based on 5 very specific goals. One of which is that we are committed to creating, developing, and fostering a culture that values and advances racial equity as an organization. That we as an organization is an effective and inclusive government that engages all communities. That our workforce reflects the diversity of our community, both across the breadth of our organization, but also through the hierarchy of our organization. And that our investments in contracting and procurement benefit the diversity of our community, and that our programs and services are responsive and reflective of the community needs. And so a couple of things that I'm really proud of, one of which is we started this racial equity work in 2011, and we have 23 very specific actions and outcomes that are part of our Racial Equity Action Plan, and of those, 17 were underway starting in 2017. So what's been nice around this Racial Equity Action Plan is that we've been able to put it into a framework that makes sense, that fits our organization mission, values, and goals, and it holds people accountable. The second part of that is all of the work that we are doing around racial equity. One of the things that we do as part of our budget process is we have performance goals and measures that are incorporated into our budget for every single department in our organization. And we report out quarterly to our board on our accomplishment of those goals and progress on them. And all of our racial equity action work is incorporated into our goals as part of our budget process every year. So with that, I know that there will be time later on for questions. It was a lot of information to share. I also want to make notice here of our website. If you go to our website, which is www.minneapolisparks.org, we have a racial equity page on our home page. If you click on that, all the work that we've been doing on racial equity is on our racial equity page. And if you click on any of the titles for any of these work pieces of documents that I've shared with you, you can also access those specifically on our website as well. So with that, I'm going to turn it over to NRPA, I think, at this point.
Yeah, thank you so much, Jane, for your presentation. And just so you all know, the materials that she was talking about that were provided, they did go out in an email before the webinar, and they will also be linked in the follow-up email that will go out after the webinar as well. And so thank you again, and with that we will move on to Allison Colman, who is the Program Manager at the National Recreation and Park Association. Allison?
Thank you, Sarah, and thank you so much, Jane, too, for just sharing some of the really impressive work that Minneapolis is doing around advancing equity. I think it's such a great example to the field and really what other communities can do as well. I'm really pleased to be here with you guys today and take part in this conversation about such an important topic. I'm going to talk a little bit more high level about the national scope of equity in parks and recreation and share a little bit about our efforts at NRPA around creating more equitable communities. I wanted to start, though, by sharing actually a little bit of information about myself. and why I'm so passionate about the role that Parks and Recreation can play in communities. I actually grew up right outside of Washington, D.C. in Northern Virginia, and for those of you who are not familiar with Northern Virginia, it is home to many of the wealthiest counties in the country. So with wealth, of course, really comes a fantastic public education system, amazing social service providers, public transportation, and of course, really great recreation amenities. But being from a community like Northern Virginia, although it's very diverse and has a lot of different races and ethnicities represented, I didn't have much exposure or firsthand experience with inequity. I never had to worry about what a lot of people in this country are faced with every single day. Things like where their next meal might be coming from, if my parents could pay the mortgage, if we couldn't go outside and play because it wasn't safe or maybe there was gang activity in the area, or if the color of my skin made me a victim of a system that really isn't representative of everyone. And it really wasn't until I started working at NRPA and had the opportunity to visit cities and neighborhoods where these concerns are asked every single day that I really began to understand. I will never forget one of my first site visits to Detroit just a few years ago, and seeing recreation center after recreation center and park after park shut down in these low-income communities. I'll never forget my visit to Tuskegee, Alabama, one of the poorest cities in our country, where the park director told us that there was only enough money to open the pool that served the white community, and that they didn't have the funding for the repairs needed for the pool that served the African American community. So these are things that I probably never really experienced growing up and never saw firsthand, but things that we really need to recognize so that we can work to correct these injustices. And I just wanted to share that because I certainly don't have all the answers, but because this is a really important topic and something that we need to continue to draw attention to and have these conversations so that together we can foster really a deeper sense of understanding and address these real issues. So with that, I will transition and talk a little bit about NRPA. We are the national nonprofit that represents all local park and recreation agencies across the country. So we are a membership association. We have over 60,000 professionals, most of whom are park and recreation professionals serving their communities. And our members reach over 200 million people across the country in all 50 states. And NRPA's mission is really to advance parks, recreation, and environmental conservation efforts to enhance quality of life. We have three pillars that really kind of bring strength to that mission: health and wellness, conservation, and social equity. And these are really the areas that we feel parks and recreation can make the largest impacts on their communities. Under each of those pillars, we have a couple of strategic objectives. Under health and wellness, our priorities are really focused on improving access to healthy foods and providing increased opportunities for physical activity. Under our conservation pillar, our main goals are around connecting people to nature and protecting our natural habitats. And lastly, under our social equity pillar, we actually really like to say that this is an overarching pillar for us, and it's infused into all of the work that we do. And that's because we really believe that every single person, no matter the color of their skin, their zip code, their income level, their sexual orientation, every single person really deserves access to the places and spaces where they can engage in physical health opportunities, mental health opportunities, social health opportunities, and enjoy those benefits that Parks and Recreation provide. So NRPA is also a granting organization, and we work with corporations and foundations to provide funding out to the field. So last year, in 2017, our work actually benefited almost 1.5 million people in 929 communities. We served 17 million meals through the federal nutrition programs. We reached 462,000 people and provided them with increased access to physical activity, and we provided 59,000 people with a greater connection to nature. In addition to that, we've really invested in low-income communities with high representations of minority populations. And last year we reached almost 1 million Hispanic persons or people of color out of that 1.4 million number. So I want to, if we could go to the next slide, that would be great. I want to dive just a little bit deeper into the role of Parks and Recreation and equity. And quickly, I just wanted to kind of reiterate the difference between equality and equity, because we found at NRPA that gets mixed up a lot. And I think that this infographic from Active Living Research is a really great way to describe equity at NRPA. If we look at the graphic, we can see that, while equality is important and focuses on treating everybody equally and giving them the same means to get from point A to point B, in reality, that really doesn't work for everyone. So what we need to be focused on is actually leveling that playing field from the beginning. And that's exactly what equity does. Equity is focused on giving people those unique tools that they need to get from point A to point B. If we can go to the next slide. So Parks and Recreation, I'm sure many of you guys are familiar, but they really do offer some amazing benefits to their communities. They're really the center of their communities. They bring people together. They're gathering places for people of all cultures and abilities. And they also provide numerous health and environmental benefits. They provide opportunities for community members to engage in physical activity. In fact, people who use parks are 3 times more likely to meet the recommended daily physical activity minimums. They also provide numerous mental health benefits, from reducing stress and anxiety, opportunities to connect socially with friends and community members, and a connection to nature, engaging people in the outdoors to hopefully foster a new generation of environmental stewards. In addition to that, parks have a lot of economic benefits. They help with attracting businesses and retaining employees, and they also increase property value. In addition to that, the fact that they provide vital services for almost all members of communities, Americans really largely support their local parks and recreation. Next slide, please. In fact, 7 in 10 Americans report going to their local park. 4 in 5 agree that they're worth their tax dollars. And a large majority of Americans say that their communities benefit from local parks. In addition to the public, elected officials really see the value of their local parks as well. And while that's the case, parks have not always met the needs of their constituents, especially in those low-income communities. So let's actually move on to the next slide, please. And one more slide, thank you. So I just want to talk a little bit about kind of the history of park usage and park access. There are really a number of events and policies that have contributed over the years to significant disparities that still exist today in terms of both park quality and park usage, and of course in health outcomes. So if we go back to the history of slavery in our country, we really must, recognize that racist policies kept whites and people of color separate, but they certainly weren't treated equally. In addition, quality of education and health care differ drastically for minority-dominated neighborhoods. One of the problems is that, the effects of centuries of segregation still plagues us today. Jim Crow laws affected almost every single aspect of daily life, mandating segregation in schools and libraries, drinking fountains, trains and restaurants, and also parks. And while, in legal theory, people of color received separate but equal treatment under the law, in actuality, that just was not the case. Public facilities for people of color were nearly always inferior to those for whites when they existed at all. And while the civil rights movement changed that, that still really lingers today among many park users. In fact, in a recent study, University of Missouri professor Kang-Jae Lee interviewed 13 African Americans who lived near a state park. And I just found this quote really interesting. he said that many of the adults that they spoke with were raised by parents who experienced the discriminatory Jim Crow laws which prevented African Americans from visiting public parks. And park attendance in America is culturally embedded, meaning that children who are raised going to parks will grow up to take their children. So many African Americans today do not go to parks because their parents and grandparents couldn't take their children. Another area contributing to these disparities is household income. In the U.S., children of color are 3 times more likely to live in households that are in poverty than white children, and that wealth gap really just continues to grow. Households that suffer from poverty are more likely to be located in underserved communities, and these communities are often those that don't have access to high-quality education, enrichment opportunities, public transportation, or parks and recreation. A few years ago, actually, NRPA conducted a survey where we found that wealthier individuals and families are more likely to use their local parks. In fact, 80% of respondents with an income of over $80,000 per year were likely to go to their park versus only 66% of people making under $40,000. And just one last example of kind of how these historical events have impacted park usage and park equity was the recession in 2008. In 2008, the recession really took a huge toll on local park and recreation agencies all across the country in nearly every community. Budgets were completely slashed, staff were laid off, and facilities were completely shut down. In these underserved neighborhoods, they just completely closed off, and in many cases were completely deemed unsafe to use. So the community even lost the opportunity to go to their local park. Next slide, please. So, you know, the recession and these other historical inequities really do impact outcomes, especially from a health and wellness lens. If we go back to a couple years ago, my first site visit in Detroit, recreation centers were still not open to the public after the recession, and this was several years later. In wealthier communities, you know, private donations or investments from foundations were able to keep parks and those services running, leading to improved health outcomes. But in low-income neighborhoods, they were really left behind. And that has really created significant health disparities in communities with only miles between them. If you look at this graphic on your screen, I think it's really fascinating. You'll see that there's actually a 6-year difference in life expectancy between neighborhoods that are only 2 miles apart in Detroit. And if we look a little bit closer too, you'll see that there's actually a 13-year difference in life expectancy in neighborhoods that are about 10 miles apart. And it's really just not okay. We need to prioritize investment into these communities and make sure that people have access to physical activity, make sure that they have access to healthy foods, make sure that we're addressing air and water quality so that we can reverse these disparities. And through parks and recreation, we can actually do that. Next slide. So NRPA is really doing a number of different things to elevate equity as a core issue in parks and recreation and better educate our professionals. We have a number of health and conservation initiatives that we implement in local park and recreation agencies through grant funding. We also have a number of resources and professional development opportunities available for our members and for park and recreation professionals. In addition to that, we're collecting data on the field. So we survey the field to better understand the landscape of parks and recreation and identify those gaps and barriers to serving underrepresented demographics. And lastly, we really use our voice and our national reach to highlight the amazing initiatives and programs and leaders like Minneapolis to advocate for changes across the board. So I'm going to share a few of our initiatives that really focus on creating more equitable communities. The first one that I want to talk about is our Commit to Health initiative. Next slide, please. Thank you. And this is really our campaign that focuses on youth health and wellness and providing underserved youth with access to healthy food, physical activity, and nutrition education. This initiative was launched in 2014, and it's our goal to engage 2,000 individual park and recreation sites in the implementation of a set of healthy eating physical activity standards. To date, we're actually in over 1,600 sites, and that's reaching over 280,000. We, through this initiative, are changing the quality of food. We're ensuring that kids are getting the physical activity they need. And we're also connecting families back to healthy eating and exercise opportunities to reinforce these behaviors at home. In addition to that, many of our agencies that participate in Commit to Health are also providing meals through the federal nutrition programs. And since 2010, our grantees have provided 76 million meals through these programs and provided over 400,000 youth with nutrition education. We know that this initiative is working. We just went actually through our first round of verification where we found that 97% of sites are meeting daily physical activity requirements and that 95% of sites are ensuring activity takes place outdoors and a number of other great impacts. The next initiative that I want to highlight was actually just rolled out in October, and that is our 10-minute walk campaign. And this is really one of our health and wellness initiatives that focuses on the built environment and ensuring that every single American has access to a quality park within a 10-minute walk of home. Research shows that 1 in 3 people does not currently have this. And in partnership with the Trust for Public Land and the Urban Land Institute, we are working with cities and mayors to ensure that they will invest back into their communities and into the neighborhoods that need it most to both improve access to park sites within a 10-minute walk and to also ensure that every neighborhood has a park within a 10-minute walk. This campaign, again, was just launched in October. And our goal is to engage 200 mayors in this commitment. To date, we're already in over 125 cities, so that will probably be going up. But a great thing that you can do is to learn more or join the campaign or see if your mayor has joined. You can go to 10minutewalk.org and check that out. And we are, of course, looking for more mayors to join that campaign and really make investment in infrastructure a priority. Next slide, please. So another initiative that I wanted to talk about is our Great Urban Parks campaign. And this is really an aspect that NRPA is focused on improving environmental and social outcomes in underserved communities through promoting green infrastructure and stormwater management. This campaign is really highlighting the multiple benefits that stormwater management projects can bring to their communities. So oftentimes in low-income communities, they're much more prone to being built on gray infrastructure and flooding, and green space doesn't exist. So this is really all about improving community health, improving access to green space and nature, and really increasing the resiliency of these communities. So if you actually look at that screen, that's an example of one project that was funded in Baltimore and essentially transforming an open lot that was at one point a park and was quite distraught over the years into a brand new park to serve the community and meet their needs, and in addition provide environmental benefits as well. And next slide. And lastly, I want to talk about our new initiative, Parks for Inclusion. This was also just launched in September, and this is perhaps our biggest and really most targeted initiative around equity to date. Parks for Inclusion supports built environment enhancements, model policy development, and best practices for program implementation to really meet the needs of those who have historically been marginalized and left out of parks and recreational opportunities. So obviously we're looking at racial and ethnic minorities through this program and how we can better meet their needs and serve them. But we're also looking at those with physical and cognitive disabilities, better ways to engage the LGBTQ community, And our goal is really that through Parks for Inclusion, by providing grant funding to support built environment projects and by providing professional development opportunities and best practice guides to our members, that we will meet the needs of 1 million additional people by September 30th, 2020. So it's a 3-year-long initiative. Next slide. So one of the other areas that NRPA works in is really collecting data from the field and working with our research team to stay on top of current trends and again determine what those challenges and barriers are for our members. Our research team administers a number of surveys out to the field each year. And we also collect impact numbers on our projects, as I mentioned earlier, including race and ethnicity and income level. But we're also starting to collect impact numbers on ability and LGBTQ users as well. And I want to highlight some of the data that we actually just gathered from our Parks for Inclusion survey that went out a few months ago. The full report will be available in January, and we'll be sure to put that on our website. But kind of some of those high-level takeaways from across the field is that we know that about 74% of agencies are targeting individuals with physical and cognitive disabilities in their inclusive efforts. 71% of agencies are targeting members of different backgrounds and races, but only about 30% of agencies are specifically targeting the LGBTQ community, and even fewer than that are targeting new Americans. So those are kind of two areas that stuck out to us as really priorities for moving this work forward and investing some additional resources in helping our agencies better serve those members of their community. One of the other interesting things that I wanted to point out are some of those barriers that our agencies identified. Of course, funding and staffing shortages are always identified as a need in the park and recreation field. We know that budgets haven't fully recovered since the recession. But some of the other areas that I found really interesting are that agencies also say it's a lack of understanding the community's needs. So there's not that community engagement piece happening in many of these communities, which is really necessary to reach these individuals and reach those most in need. In addition to that, there's a lack of staff training and really insufficient outreach that's happening. But one of the positive things that came out of that survey is that it wasn't because of desire. Most of these park and recreation professionals indicated that both local governments and the community is supportive of inclusive efforts and really supportive of investing resources to make their communities more inclusive and equitable. Next slide, please. So one of the really great things that we have that our agencies can utilize are these facility market reports. These are a really great tool to gain demographic and marketing information about residents, including health and wellness information. There's actually two types of reports that our agencies can utilize. If you go to the next slide, one is focused on the community profile, and the other is highlighting health and wellness, so things like fruit and vegetable consumption, physical activity rates, and you can actually get these facility market reports by selecting the distance that most people access your park or your recreation center from. So if it's a 10-minute walk, you could select 10-minute walk, and it'll provide you with that demographic information from that distance. But one of the other things that we make sure to tell our agencies to keep in mind, and where we try to provide additional support around, is while data is really great, community engagement can't be neglected. So, using these facility market reports is really awesome, but it's critical to engage the community in the conversation around programming and investing in projects. Too often, major projects are invested in that are beautiful and full of amenities, but they sit unused because it might not necessarily be what the community needs. If most of the kids in the community want to play soccer, but you build a baseball field, you're really not meeting the needs of those who are using the park. So that's just something to keep in mind. And lastly, one of the other areas where we really work on that national scale is through our storytelling ability and using our national voice. NRPA has an initiative called Park Champions, where we encourage our local agencies to invite their local elected officials, but also members of Congress, out to their park sites so that they can see the great work that they're doing and see the programs in action. This also fosters a great opportunity to, again, engage with the community and engage with constituents. In addition to that, we collect a number of success stories and best practices and highlight those in the field. So I do want to talk about, just quickly, a few really special initiatives that we've seen from some of our local agencies over the years that are really focused on advancing equity in their communities. So next slide, please, and I will jump into talking about some of the work that New Orleans is doing. So, of course, most of you are probably familiar that after the hurricane in New Orleans, after Katrina, the city was essentially shattered in the lower Ninth Ward. Thousands of lives, of homes, of community assets were lost. And, you know, following the storm, immediately after, New Orleans also found that both adults and children in their community were really suffering from a lot of health issues. They had inadequate fruit and vegetable consumption, and really a lack of access to playgrounds or opportunities to be physically active through any type of community center or park and recreation facility. Next slide, please. In addition to that, a 2012 county health ranking study determined that Orleans Parish was actually ranked 60th out of 64 in health outcomes based on premature death and quality of life. Next slide, please. So, you know, the city and the New Orleans Recreation Development Commission really took that to heart, and they've made some tremendous strides over the years following Hurricane Katrina. They essentially knew that they had to invest in those communities that were hit the hardest. So they looked at poverty levels across the city, they looked at income levels, and they looked at crime rates, as well as the presence of a park and recreation facility or a park in these communities, so that they could select areas to implement some new and innovative health programming. Next slide. And what they actually came up with were two really great park prescription initiatives. So one that focused on fruit and vegetable consumption, because that was identified as an issue, was called Veggie RX. So this was actually a great program where community members would receive a voucher to go to their local farmers market and actually buy fruits and vegetables at no cost. So doctors could prescribe these vouchers and constituents could go and redeem them. Next slide, please. And in addition to the Veggie RX, they also started a Fit RX program in these neighborhoods. So community members, children, and adults could take free exercise classes at their local parks, getting them active in a safe and supervised environment. Next slide. In addition to that, New Orleans also received a significant amount of funding from FEMA funds to help with disaster recovery, and they've really invested again in those communities by adding recreation centers, community centers, fitness centers. They went from 1 fitness center to 7. And in addition to that, they invested in playgrounds with staff there so that children in those communities that may have had a playground, but it wasn't really deemed safe, or parents and caregivers were concerned with supervision, they actually staffed those playgrounds so kids could play as well. And next slide, please. And one more. So with all of those efforts, there were really some pretty significant results. About 75% of the fruit and vegetable vouchers were, 84% were actually redeemed when they thought only 75% would be. And next slide, please. And they had some really high rates of people joining their recreation centers, of making visits and taking exercise classes. And last slide, please. And out of that, they actually moved that health ranking from 60 to 40th out of the 64 parishes in overall health, again, based on premature death and quality of life. So some really significant results there, and essentially just investing in those communities that needed it the most. And next slide, please. And so quickly, I'll talk about just one other program. I know we're running out of time and want time for questions here. But NRPA has also been working with the Lakeshore Foundation to provide some micro grants to our agencies to help support their inclusion and equity efforts. So we recently announced 4 micro grants for programs that are supporting both cognitive and physical development. And one of those is focused on a bike riding program in Austin, Texas. One is focused on an intergenerational community garden that's bringing together people from different races and ethnicities and ages. And another interesting program is actually a nature sensory program in Philadelphia. So those are just some of the kind of highlights from our micro grant program. And we hope to continue to have those programs in the future. And if you want to go to the next slide, and one more slide, and actually one more. I'll just skip over that since I know we're running out of time. Just some of our future efforts around equity and inclusion at NRPA. We really, again, want to be investing in additional resources for our park and recreation professionals. That survey helped to identify that there's definitely a gap in formal policy that exists in park and recreation sites. Only about 40% of agencies indicate that they have a formal policy around equity and inclusion. So we want to see that number rise, and we want to provide guidance on that. In addition, providing additional best practices and case studies, as well as professional development opportunities, and as I mentioned before, obviously working to secure grant funding to be able to put that back out into the field and implement many of these micro grants and park improvement projects to support health equity. So that is my contact information, and please feel free to reach out if you have additional questions or want more information about any of this. Thank you very much.
Great. Thank you so much, Allison. We've got a few minutes for questions, and if you all do have a question, go ahead and type it into the chat just to the private host, and we can field those questions for you. But I did want to start, Allison, and then to Jayne. You had talked about a lack of community understanding with what the needs of parks and recreation facilities. So I just wanted to hear from both of you, how do you suggest or how do you actually get resident input from what's needed in the parks in specific neighborhoods and communities?
So this is Jayne. If I could start, that would be great. We actually have a really extensive community engagement process here in Minneapolis. In fact, we have an ordinance in place that requires us to do really extensive community engagement, and that ordinance is online. We also, so part of our process is we create community advisory committees that engage a variety of people across organizations and neighborhoods, depending on where the park project is being done. We've also done some really creative things to get involvement. We actually go into the schools, engage kids in their classrooms around playgrounds. We also do creative things like this summer in one of our parks in a low-income area. We held a 2-day camp for teenagers to understand what it takes to put in a park pavilion. So what it takes architecture-wise, help them to understand that. They gave us feedback, and through that camp, they actually made recommendations for a recommendation for a picnic shelter to go in the park. We also created in North Minneapolis, one of our most economically and racially challenged areas of the city, we provided funding for what are called community connectors. So we allowed people to apply to be a community connector, where they would receive pay to engage in a variety of different ways, whatever they came up with, to give input on our master plans for the North Service area. The Community Advisory Commission interviewed all those community connectors and selected 12 that are going to engage people in North Minneapolis in different ways that we might otherwise not have been able to as successfully through those community connectors. And so those are just some different examples of things that we are doing to differently engage people who otherwise may not otherwise be engaged in the public process.
Great.
Yeah, and
thank you, Jayne.
I'll just add to that. You know, we have a couple of resources around community engagement, and one of them I included in the resources for today. It's our Safe Routes to Parks Action Framework, and there is a whole section on community engagement in there, and really a framework that Park and Recreation or really any other community service provider can follow for ensuring that they are engaging the community in that conversation through both surveys, focus groups, a number of different tactics. So I would just recommend checking that resource out as well.
Wonderful. Thank you so much, Jayne and Allison, for answering that question. We have come to the end of our time, but I will include Jayne and Allison's contact information, so any other questions they will be available to help answer. And thank you guys so much again for joining us and for volunteering your time to present.
Thank you.
Great, thank you.